Hello and welcome to Essentials of Pharmacology for Health Professions, 9th edition, Chapter 2, which covers drug names and references. Please make sure to read this chapter as I will only be summarizing it. Upon completion of this chapter, you should be able to describe drug classification systems, differentiate among the following drug names, which is generic, official, trade, and chemical. Explain what is indicated by a number included in a drug trade name, like Tylenol 3. Discuss the purpose of tall man lettering. Explain the restrictions of drug sales implied by the following, like over-the-counter, legend drug, off-label drug use, and controlled substances. Discuss the various terms indicating drug actions contained in reference sources. Describe drug references available today. Discuss characteristics that you consider important in choosing the best drug reference. Pharmacology is the study of drugs and their origin, nature, properties, and effects on living organisms. So, to be able to provide clarity of the drugs that are on the market, the following are resources that assist to know why drugs are given, how they work, and what effects to expect. First one is numerous drug references geared to a variety of levels of readers, from a layperson to a pharmacist. The second is grouping of drugs under broad subcategories. The third is continuing in the use of basic identifying terms for the names and action of drugs. Drugs can be categorized under a broad subcategory of subcategories called classifications. Grouping them together according to a therapeutic use is helpful. Drugs that affect the body in similar ways are listed in the same classification. The major drug classifications include the therapeutic uses, most common side effects, precautions to be used, your contraindications when the drug is not in the use, or when not to use the drug, your interactions that may occur when taken with other foods or drugs, and then some of the most common product names, their usual dosages, and comments on administrations. Okay, what you are looking at are some of the common drug classifications. We have 8 of those. The first one is the lipid lower agents. The second is antidepressants. Third is narcotic analgesics. 4 is antihypertensive. 5 is diuretics. 6 is anti-diabetes. 7 is antibiotics. And 8 is anticoagulants. Please make sure to review their therapeutic use and some of the drug examples. Check your knowledge. The first question is, drugs are classified by. Look at your choices. Pause the video, and we can check our answers at the end of the video. Identifying drug names. Drug names can be very complicated, as each drug can have many names attached to it. When a company produces a new drug, they assign a generic name to it. After testing has been completed by the Food and Drug Administration, your FDA, the drug company then gives it a trade name, which is often a shorter name and easier for us to remember. From the time that the drug company submits the application for a new drug to the FDA for approval, the company has exclusive rights to market the drug for 5 years. 5 years, guys. Once approved, the drug is listed in the USP/NF by an official name, generally the same name as the generic name. Alright. So we're looking at generic name. What is a generic name? It is a common or general name assigned to the drug by the United States adopted name. It's USAN for short, cancel. It is differentiated from the trade name by the initial lower case letter. that which is never capitalized. Okay. So our trade name, which is our brand name, that name by which a pharmaceutical company identifies its product. It is copyrighted and used exclusively by that company. It is distinguished from the generic name by the capitalized first letter, often shown on labels and references with a symbol or with a circle in it after the name for registered trademark. This is important information that you need to remember. Okay, so what does chemical name mean? What that means is it is the exact molecular formula of the drug. That's the chemical name. It's very long and it's very, very difficult to pronounce. And for us as healthcare providers, we do not pay attention to the chemical name. Just saying. The official name is the name of the drug as it appears in the official reference, which is the United States Pharmacopoeia or National Formulary USP/NF, and usually it's the same as the generic name. Most states have enacted legislation encouraging physicians to let pharmacists substitute less expensive generic equivalents for brand name drugs. Of course, laws may vary from state to state. Some reasons that physicians may state no substitutions and may indicate dispense as written, DAW, can include physicians may have preference for treatment. The patients may be difficult to stabilize on certain class of medications due to fillers being slightly different. And dyes may alter effects in some sensitive patients, leading to allergic responses. Alright, so we're looking at Table 2-2, which can be found in your ebook as well. It is giving you a comparison of drug names. So we see generic name, we see chemical name, and we also see the trade names. And you look at each one of them and see what the difference is. When we looked at the previous, and just a few minutes ago, when we were looking, we talked about generic, we talked about trade, and we talked about the chemical names. And now you can put it in perspective by looking at those and being able to tell the difference. Let's take a look at Table 2-3, and here are a few examples of combination drugs. So you see the trade name, which is Diazide. It is used to treat high blood pressure. But let's look at the generic name and the amount. With this being a combination drug, you see hydrochlorothiazide, which is 25 milligrams, and Trimarine, which is 37.5 milligrams. And you can look at the rest of them, the other two, and see the combinations and the amounts. Check your knowledge. The proprietary or brand name of a drug is known as the following. Look at your choices, pause the video, and we will check our answers at the end. Trade name drugs may include numbers. The number generally refers to an amount of the generic components which helps differentiate it from almost identical product. So what you're looking at, the table that you're looking at demonstrates the amount of
acetaminophen
with varying amounts of controlled substances. So we should be somewhat familiar with like Tylenol 2, 3, and 4. The only difference is the amount of codeine that is in each of them. Let's do a check your knowledge on what we just learned. The number that is associated with a trade name of a drug refers to. Let's look at your choices. Pause the video and we will check our answers at the end. What is the purpose of tall man lettering? We have a lot of medication that look alike and sound alike, which causes a lot of drug errors. So it's very imperative that there be a process in place to help reduce the number of medication errors and to ensure our patients' safety. In addition to a list of confused drug names, a distinct process identified as the Tallman lettering was created to ensure emphasis in place on specific parts of the drug name and to assist in the reduction of medication error. If you'll take a look and see the example that has been provided between Celebrex and Celexa. On Celexa, the last 2 letters are capitalized. In Celebrex, the last 4 letters are capitalized. And the reason to do that is to help grab the attention of the person that is ordering those medications. Let's do a check your knowledge and see what we've learned thus far. Which is a process set in place to reduce medication error? Look at your choices. Pause the video. We can check our answers at the end. Drugs not only have classification, generic names, trade names, chemical names, or official names, they also have names that imply the legality of accessibility. Some legal terms refer to drugs include the over-the-counter drugs, or legend drugs, controlled substance, and off-label medications. Over-the-counter medications, no person restrictions by the FDA except with the exception of
pseudoephedrine,
which is the over-the-counter, but it is kept behind the pharmacy counter. Now, our legend drug is a prescription drug determined unsafe for over-the-counter persons because of the possible side effects if it's not taken carefully. And those are your birth control pills, antibiotics, cardiac drugs, and hormones. A legend drug requires a legend or warning statement. Federal law prohibits dispensing without a prescription warning on its medication bottle. Controlled substance. Drug controlled by prescription requirement because of the danger of addiction or abuse. It is indicated in references by schedule number, which is your C1 to C4, which we've already talked about. Your off-label medication is drug used in a way not indicated on the FDA label. An example would be an antidepressant that is used to treat nerve pain. Alright, what we are looking at is a drug label, and the trade name is Percocet. And it has 2 generic drugs, which is oxycodone and
acetaminophen,
which is and it has the controlled substance marking. So if you'll look, you see the NDC number at the top of it. To the far left, you see the amounts. Oxycodone is the 5. The 325 is the
acetaminophen.
And then you also see at the very bottom where it's brand. You see how many tablets it has. You see with the RX that it has to be prescription only. You also have the barcode. Take a minute and to review this label, which is also located in your book, in your ebook, that you can look at it a little bit closer if you need to. Let's do check your knowledge. Your question is, what is an example of a legend drug? Look at your choices, pause the video, and we can answer it and check your answers at the end of the video. When researching drugs, the various drug reference was utilize a similar format to describe drugs. It is important to understand the specific headings and what is found within those headings used in reference tools to quickly obtain information. So when we're looking, if you look at this table, we're looking at heading and we're looking at components. So we're looking at indications. What does indication mean? It's the list of the medical condition or diseases for which the drug is meant to be used. The actions is a description of cellular changes that occur as a result of the drug. Your contraindications is a list of conditions for which the drug should not be given. Your cautions is the list of conditions or types of patients that warrant closer observation for specific side effects when given the drug. Your side effects or your adverse reaction is the list of possible unpleasant or dangerous secondary effects when given the drug. And then your interactions is the list of other drugs or foods that may alter the effect of the drug and usually should not be given during the same course of therapy. So these are something that we'll be looking at when we get ready to do our drug cards. Check your knowledge. A list of other drugs or food that may alter the effects of a drug and should not be given during the same course of therapy is known as. Look at your choices. Pause the video, write down your answer, and we're going to check it at the end once we're completed. It is very imperative that we become knowledgeable about the drugs that we are going to help dispense. There are many different drug reference guides that can help us, and selecting one of the most suitable one for our practice is important. The three that are most utilized are the physician desk reference, which is your PDR, which is most widely used and is available 3 versions to include the online, mobile app, and a book. You have the USP/NF, which is available only online. Your AHFS drug information, which is American Health System Formulary Service, is available in paperback form by volumes. Alright, so let's talk about the 3 drug reference guides. You got the PDR, the USP/NF, and then your AHFS. What we're looking at is the pros and cons. So, for instance, on the PDF, what makes that stand out in the pros? Well, it comes in all 3 in all 3 platforms. It comes in the online book and the mobile app. Now, one con on that is that when it comes to over-the-counter drugs, you would have to buy a whole nother set because it does not come included in it. So make sure you get familiar with these so you'll know the difference between the drug reference guides and which one's going to be more suitable to help you. Check your knowledge. This question is, which drug reference source provides incomplete information on over-the-counter medications? Look at your choices, pause the video, write your answer down, and we're going to check it at the end of the video. What are some important characteristics of a drug reference? Selecting the best drug reference source is important. Being able to find imperative information to ensure your patient's safety is a big responsibility. Some things to think about when selecting the most appropriate source could be accessibility, ease in finding information, being able to verify drugs through pictures, making sure you've got the right medication, being able to locate the contraindication, the side effects is also important, but as well is being able to get to that information quickly. And of course, we always want to double check the reputation of the material that is printed. Check your knowledge. Which characteristics would be important when choosing the best reference source? Pause the video, look at your choices, write your answers down so you can check them at the end of this lesson. This is the end of the lecture. Let's take a look at the self-assessment. What are some things that can be done on your part? Ask yourself, can you differentiate between the term trade, generic, chemical, and official as they relate to drug names? How does Tallman lettering help to reduce medication errors? Can you explain the terms used to describe drug actions that appear as headings under each drug in a drug reference source? Here are the knowledge check activity answers. If you have any questions, make sure to email me, call me, or talk to me while we are in class. Thank you.